Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. First, we'll welcome Dr. Paul Whitesides and nurse practitioner Jenny Zimber of the newly opened clinic Novant Health Endocrinology. Then we'll meet Dr. Tabitha DeLoe, who has recently joined Novant Health OBGYN. And finally, we'll welcome back Dr. Lydia Labachetta of Novant Health Urology Partners to learn more about incontinence and other pelvic health issues affecting women. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Paul Whitesides and nurse practitioner Jenny Zimber of Novant Health Endocrinology. Well, welcome to the show today, Jenny and Dr. Whitesides. It's such a pleasure to see both of you.
We're very happy to be here.
It's fun to be here.
Good, because I'm really interested in the new practice, so this is really exciting. So Jenny, I know a lot of our viewers probably know you from your time here at Novant Health Family and Internal Medicine in South Brunswick. So, but there may be somebody out there who hasn't met you yet. So tell us a little bit about your education and your background.
Okay, I've spent 30 years as a nurse, the last 10 as a nurse practitioner. I got my bachelor's and master's degrees from Stony Brook University in New York. When I got my NP license, I immediately went to work with Dr. Whitesides at Hanover Medical Specialists, which later became Wilmington Health Endocrinology, and moved to Novant in 2013.
So the vast majority of your experience has been in endocrinology, is that correct?
Yes, that is correct.
Yeah, you must really like it.
I do, I love it.
And Dr. Whitesides, I know you're a familiar face around here. You've been in practice many, many years. And tell us a little bit about your education and your background.
Yeah, so I've been here 35 years.
And you guys work together, right?
That's right, for a good many years.
Yeah.
But I went to college at Duke, and then
Just Duke, huh?
Yeah. Had a hard time getting through that first year. But after that, I went to medical school in Charleston, and then did my internal medicine residency at MCV in Richmond, Virginia. Then came back to Duke to do my endocrinology fellowship. Then my wife and I just came down here and set up a practice in 1982.
Wow. And you were recently retired, I understand, and now you're back sort of part-time.
Yeah, I took a little sabbatical for a while. Well, enjoyed that immensely, but yeah, I'm having fun, getting back in the saddle.
I'm curious, what actually drew you to endocrinology in the beginning?
Yeah, I was a chemistry major in college, and so I tried to find some field that was kind of close to that, and endocrine was about the closest thing. And plus I had some really good professors when I was a resident in Richmond. They kind of, pointing me that way as well.
Yeah. Well, you must really enjoy it because you've done it for quite a while, and now you're sort of back in the saddle, as you say. So. That's great. Well, we're really excited here locally about the opening of the Novant Health Endocrinology. So Jenny, tell us a little bit about the clinic, where it's located, and the hours of operation.
The clinic is located at 75 Emerson Bay Drive in Suite 102. We're sharing space with Internal and Family Medicine of South Brunswick. The clinic is open Monday through Friday. 8 to 5 Monday through Thursday, and 8 to 12 on Friday.
Great. But I hear that you're going to be moving in not too distant future to a location in Supply. I think that's sometime this winter, perhaps?
Hopefully at the end of the year we'll be moving down to a more central location so that it's easier for our patients from all areas of Brunswick County to access the clinic.
I'm curious, how far away do you attract patients? I mean, do you attract them from Leland all the way down to Calabash, or?
I have some down in, several from Leland. The majority of them are either Central Brunswick or South.
So by putting it more centrally located, it will be more convenient to all of them. Is that correct? Well, when most of us think of endocrinology, I think we often think about diabetes management. So, Dr. Whiteside, is that one of the main services that you provide at the clinic?
Yeah, certainly. I suspect probably over half the practice is diabetes, probably approaches 70% or so.
Really?
Yeah, so it's a very large part.
Well, for patients with diabetes, what types of care would you perform for them?
We pretty much provide their whole, diabetes care, and
And what does that consist of?
Well, certainly basically there are two types. So you have type 1 diabetics who they don't make any insulin, so they're very tricky. So you have to manage their insulin. Those are the ones that sometimes need pump sensors, and that's where the technology comes into play. And then you have your type 2s. Usually the old adult onset. They usually make a little bit of insulin, but not enough, and that's where. And the medications we have for them are expanding and getting very complex. Plus, there's a lot of other behavioral things you have to work on and with them.
So type 2 is adult onset?
Correct.
Does it ever escalate to type 1?
There's the reason they changed it from adult and juvenile was that some adults, I think 10% get type 1. So that's why they shifted it to type 1 and type 2.
It's complicated.
Yeah.
For me, it's a little complicated. I don't quite understand.
Yeah, so some people who look like they're type 2s actually can progress on to type 1 where they don't make any insulin.
I know I have a friend that has a pump, and that's been like a lifesaver to them because it's just so much easier for them to control. Well, Jenny, I know that endocrinology encompasses many other conditions as well. So tell me about some of the other treatments or services that are provided there at the clinic.
Besides diabetes, we also manage thyroid problems, parathyroid problems, osteoporosis, obesity, and adrenal gland problems.
Wow, that's a lot of other things. And are those pretty much typically managed by medication and just a change in behaviors and things like that?
Yeah, many of them are closely followed by lab work.
Okay. And do you have an on-site lab at the office?
We currently have an on-site lab, yes.
And do you intend for that to be at the new facility when it opens up this winter?
I think that will depend on the need. If we have enough need, then yes, we would probably have a draw center there.
Well, let's talk about how you get an appointment and referrals and stuff like that. So would I need a referral to come to you?
Yes, you definitely need a referral to come to us. Typically, primary care providers will send a referral for endocrinology consult, and that's taken care of by our referral center.
The centralized referral center. So what if you have a physician that's not part of the Novant Health family? How do they make a referral?
They can fax us a referral or call the office and ask for a referral at that point.
Are you currently taking new patients?
Yes.
Yes. And how might we do that? How might we make an appointment?
You'd need a referral first.
Okay. And do they make the appointment, or does the patient have to call the office and do that?
No, our office will follow up with the patient to schedule an appointment.
I see. Okay, that's great information. Well, before we wrap up, what would you like to say to our viewers out there who might be thinking they might need an endocrinologist?
If you think you need an endocrinologist, then talk to your primary care provider. You are part of your healthcare team and have an equal voice, and just request that you have a consultation. If you get to us and we feel as though you're well managed by your primary care provider,
so you might
we'll send you back.
I see. So you still maintain that relationship with your primary care then?
Absolutely.
Yeah, great. Well, this has been great information. It's wonderful for Brunswick County. We've been too long without an endocrinologist. Thank you for coming out of retirement and joining Novant Health. That's awesome. And thank you, Jenny, for everything you've done over these last few years for us. You've been a great plus for us. So
Thank you.
thanks again for being here today.
Thanks for having
Thank
us.
you.
Our next guest is Dr. Tabitha DeLoe of Novant Health OBGYN. Well, Dr. DeLoe, welcome to the show today. What a pleasure.
Thank you so much for having me.
Well, you're quite welcome. Now, I understand you recently joined Novant Health OBGYN, correct?
Yes, that is absolutely true.
Great. Well, tell me, where are you coming from, and where did you move from and all that? I want to get to know you.
Well, thank you. We are moving back from Pittsburgh. So
From Pennsylvania?
Yes, ma'am. And we lived there for 10 years and practiced there, and now we came
Back home?
back to the North Carolina.
Well, awesome. Well, we're happy to have you.
Thank you.
So, do you have North Carolina connections?
I do.
Tell me about that.
My husband and I did our residencies in Greenville, North Carolina.
Okay.
And so some of my previous attendings and other colleagues have moved from Greenville into the Wilmington area.
Really?
So I know quite a few physicians in Wilmington.
Uh-huh. Now, your husband's a physician also,
Yes,
is that correct?
he's a rheumatologist.
Rheumatologist. Well, there's always a need for that.
Yes.
So, did you always think you might move back to North Carolina?
No, we thought we were going back to Pittsburgh and we were
Oh.
staying there, and then this opportunity came up.
Wonderful.
And we wanted to take a closer look, and it turns out that we wanted to stay.
Awesome. Well, we've talked, let's talk about your education. Where did you go to school?
I did medical school at West Virginia University.
Oh,
and
in my backyard.
that's right. I forgot about that. And then we did residency in Greenville, North Carolina.
Great. Well, as an OBGYN, I know you cover a broad range of services for women. Will you be doing both gynecological as well as obstetrical services?
Yes.
Okay.
Yes.
Great. And are you going to offer gynecological surgery?
Yes.
Great.
We do in-office procedures as well as outpatient and inpatient procedures. So we have one of our offices, we have 4 locations with Novant in Bolivia, Leland, Carolina Shores, and Southport. And I do believe that all the offices offer procedures.
And so that's great for patients because it's so convenient.
Yes.
This is such a huge county,
Yes.
and they come from everywhere, so that makes it much more
It's
convenient.
nice to have access all over.
Well, Dr. DeLoe, do you have any special interests that...
I am very interested in LARC, which is long-acting reversible contraception, such as the Mirena IUD, the Depo-Provera shot,
Really?
Nexplanon. All of those are just fabulous forms of contraception, but they also can help with abnormal uterine bleeding or dysfunctional uterine bleeding, heavy bleeding, and can really just make lives a lot better.
And so will you be utilizing some of those
Absolutely.
devices
Absolutely.
in your practice? Well, that's nice. That gives everybody an option.
Yes. Yes, I find them to be very patient-friendly, and the success rate is very high.
So more than just the pill. I mean, everybody knows about
Absolutely,
the pill, but
right. But that's not
they're-
they're not without its
Right, so-
contraindications.
So it's nice to know there are alternatives.
Yes, and they can sometimes stop you from having to have a surgery.
Yeah, sure. Well, I know that I know most of your partners. Well, I know all of your partners,
Yes.
and they're great. And I just think you'll be a great addition to that.
Thank you.
But for our viewers who might not be familiar with the clinic, let's talk a little bit about those clinics.
Yes.
Now, I know you had you said there were 4 locations.
Yes.
And so, at which location will you be?
I will be in Leland and in Bolivia.
And so all of the physicians, they sort of rotate through some
Yes.
of these satellites,
Yes.
if you will.
That's correct. That's correct.
Well, that's good. And I think it just gives patients many more options of where they
Yes.
want to go and who they want to see. Well, I guess you're accepting new patients, right?
Yes, ma'am. I will be open for business.
Well, before we wrap up, I would like to talk a little bit about your past experiences in terms of the numbers of surgeries. Have you been very busy? And
Yes.
things like that. Let's talk a little bit about that.
So I worked, the previous hospital that I worked at was extremely busy. So we did a little, like 10,000 deliveries a year.
Oh my.
So I have a lot of delivery experience, and as far as cesarean sections, I also had a surgery day every month where I would schedule at least 7 or 8 cases at our outpatient surgery center. Absolutely, I have a lot of experience with minors, not so much majors anymore, as far as the robotic trend kind of started after I was done training, but several of my partners utilize the robotic surgery.
Yes,
so I have a referral base within my practice.
Yeah, absolutely. And so that's a well-rounded office because everybody has their little niche.
Yep.
And then there are people who are specialized in robotics and people who do other things. So it's just a good mix. And I think you'll be very happy there.
I think so too. I'm looking forward to it.
Well, great. Well, it's been a pleasure to have you here today.
Thank you
it's
so
such
much.
a pleasure to meet you. I hope you and your family enjoy Brunswick County.
Thank you.
And I believe you will. I think you'll be very happy here.
Thank you so much for having me.
You're quite welcome.
Thanks.
Our final guest today is Dr. Lydia Labachetta of Novant Health Urology Partners. Welcome back to the show today, Dr. Lydia Labachetta. How are you?
I'm great. Thanks for having me again.
Oh, it's always a pleasure to have you. You're so much fun. Now, there might be somebody out there who didn't meet you before, so let's let them know about your education and your background, okay?
Sure. Yeah. Well, my background was actually in theater. And
I know. It's so exciting.
Yeah. I don't get to do a lot of that now. But, I did my medical school training kind of after all that. And so I was in medical school in Norfolk, Virginia, and then I did my residency training down in Charleston, South Carolina. And my husband and I always knew that we wanted to move back to this area, so that was kind of our goal right along to be back here somehow doing something.
Yeah, sometimes I forget you're actually from Wilmington.
Yeah, my grandmother was reared in Winter Park.
How cool is that? Yeah. And I remember she's a seamstress, right? Didn't she sew?
She does. She is. She wears a lot of different hats, but she taught me how to sew.
Yeah, that's great. I always think that's so fascinating. So, you've been with Novant Health Urology Partners for quite a while now.
Yeah, going on 4 years.
Yeah, that's great. Seems like yesterday you were on the show and it was like our first few shows, and that was so cool. Yeah. Well, today I think we're here to talk about a specific topic, and that is incontinence and other women's pelvic floor health conditions, right? So what are some of the most common pelvic health conditions that you treat for women?
I would say the most common things are related to urinary issues, specifically, just because usually people don't necessarily think of a urologist when they're dealing with prolapse issues and things like that. But definitely a lot of urinary tract infection, a lot of urinary urgency, frequency, and leakage problems. The leaky ladies.
The leaky ladies. Well, tell me a little bit about those conditions and what those symptoms, how they present.
Well, I think that it's one of those things that is really frustrating to me about women in general. I think that we just don't advocate for ourselves very well.
You're right.
You know, I think that women are willing to put up with a lot and are inclined to assume that nothing can help them. And so one of my kind of frustrations and missions is really to work on getting people to just come through the door. Because, you know, I think that a lot of these urinary incontinence issues present, instead of really just presenting with leakage, it presents with like not playing with your kids. You know, it presents with not going swimming at the ocean because you're afraid that somebody's going to see that your bathing suit is a little bit damp, you know? And so I think that one of my goals is really to say, okay, we can't all be 17 again, and we can't all be perfect, but we can definitely do better. And I think that every woman is entitled to the joie de vivre that comes with just enjoying your life. And if you're paying attention to your stupid bladder all the time, then you're not enjoying your life.
Right.
It's really anything that's occupying that much focus and attention is not allowing you to really enjoy your life. And quality of life is so important to urologists. I think that's relevant.
Yeah. So I would think that some of us might think we're just getting old. And so we think that's normal.
And I really hope not, because I'm not that old, and and I don't want to be having those problems when I'm older. And I see so many women who are older who are not having those problems. So I do think that there are certainly some physiologic changes that happen with aging. You know, I mean, if you've had big babies, you know, there's a good chance that that the pelvic floor has been disturbed, changed, your anatomy has been shifted. Definitely there are changes in the vaginal environment that come with aging that can be remedied. And, you know, again, we're not all going to be 17 again, but we can certainly do better. And okay, yeah, maybe sometimes patients have to wear a panty liner still after treatment, but if you're not wearing a thick pad and you're not worried about, oh, well, I'm going on my cruise to Disneyland, I better make sure that I take a suitcase full of undergarments. I mean, that's a real quality of life issue that patients don't even realize until it's not there anymore. And I hope that we are able to get the word out and get some patients to come in and just talk about these things.
Yeah. Well, if a woman finally gets the courage to come to your office and to talk about these things, what do they typically say once they've had the treatment and are maybe improved? What would they say?
Oh, I mean, I think, again, it's one of those things that you don't even realize how much it's affecting your quality of life until it's not anymore. I tell people it's like the hiccups, because you get the hiccups and you kind of almost get a headache from the hiccups, and then the hiccups are gone and you're like, where'd the hiccups go? It's kind of like that. I think that it's something that just affects you so much more than you even realize. That most of the patients, I see a number of patients who are just so glad.
Do they all wish they'd been there sooner?
Yeah, absolutely. A lot of patients say, you know, I just wish that I had known about this earlier, or come in sooner, or had the courage to talk to somebody about it sooner.
Yeah. Well, let's talk specifically about incontinence. Tell me about some of the treatments that you would apply for that.
So first we have to sort out whether patients are having urge incontinence or stress incontinence. They're very different, and the treatments are different. The treatment for stress urinary incontinence is, it's an anatomic problem, so we can do exercises. And data have shown that most women who do the exercises, if their stress incontinence is bad enough, end up requiring surgery. And so we start counseling patients early on about surgical options for the stress component. And that's like coughing, sneezing, jumping on the trampoline, running after your kids, that kind of thing. As far as urgency and urge urinary incontinence are concerned, that is a behavioral problem really more than anything else. It's it has to do with that idea that it's just part of getting older.
I told you.
And you know, hitting up every single bathroom along the way, and basically just training your bladder.
I have a friend who says, I never pass up a bathroom, just in case.
I have about 873 patients who say that. And that's, that can kind of work against you, because the smaller the less volume your bladder stores, the less it wants to store. So one of the things that I work with patients on is just really delaying that that void, and using medications if we need to help make that happen. And even Botox injections for patients who are really having debilitating urgency and frequency.
A while ago in the interview, you talked about prolapse, some pelvic organ prolapse. Explain to me what that is and what kind of treatment.
Sure. So pelvic organ prolapse can sometimes contribute to urinary symptoms because the vaginal vault is like it's like an old coffee can. So imagine an old coffee can with 3 sides.
Okay.
So, you know, the coffee can really has to be intact all the way up.
Okay.
And so in the female vagina, you can have the bladder come down on the front side of the vagina. You can have the rectum come down on the back side of the vagina, or you can have the whole thing almost slinky out. And so by identifying the different compartments that are being affected by prolapse, we can help to address both urinary issues and also functional issues related to discomfort during intercourse and that sort of thing.
And I assume that would probably require surgery for something like a prolapse?
Definitely surgery is one option, and there are lots of different types of surgical options. So we can do transvaginal surgeries. We can actually do a surgery for prolapse through the belly with the robot, and that's called a robotic sacral colpopexy, which is a really cool procedure and has been
you perform that, correct?
Yes, and that way has a slightly decreased risk of discomfort during intercourse. And also, pessary is a great option for patients that just don't want surgery but are having some functional outcomes that are being affected by their prolapse. And that's basically, it's like a plug.
Like a plug.
To just hold everything up inside.
Oh, well, that doesn't sound too bad. Well, before we wrap up, is there anything that you would like to add for our viewers?
Absolutely. I think, you know, as a surgeon, obviously the things that I always think about are surgical because I'm a fixer. I like to fix things quickly.
Sure.
But we have an excellent resource in our community. There's a pelvic floor physical therapist, Ashley Harrington, who works with a number of my patients. And I think, especially for patients that hear the surgery word and are just totally turned off by that, I still would encourage them that there are lots of different options, and physical therapy is one of those that's very advantageous.
And you would provide a referral for any of your patients to that office?
Absolutely. We work together pretty closely. And oftentimes my surgical patients end up using physical therapy as a component of their treatment also. So I think that's an important piece.
That sounds wonderful. Well, I can't thank you enough for being here today. You're always a treat and always such fun. We laugh a lot. So how about your office number? Do you know your phone number?
I do know my phone number. It's 910-721-4150. And Debbie and Amy are our schedulers, and they're wizards. They find places for people that are almost impossible. So
awesome. Well, thanks again for being here.
Thanks for
I
having
look
me.
forward to you coming back again. You're always so much fun. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.
This is what security video used to look like, and this is HD video monitoring from ATMC Security. Now it's easier than ever to keep tabs on the kids, see when deliveries arrive, and make sure your home is secure. Check in from any device, anywhere. ATMC Security offers remote access, real-time alerts, video monitoring and recording, and more. Combine smart home solutions with 24/7 emergency monitoring for one great low price. ATMC Security. Safeguard your home.
Stay connected with your community channel. Like ATMC TV on Facebook today.